everybody, we are coming to you from Atlantic Health System's brand new testing facility here in Union County, of course, in the town of Union on Morris Avenue. I'm Luke Margolis. I'm the Corporate Communications Director for Atlantic Health, and I am joined today by Dr. Stephen Sherris. Good to see you, Dr. Sherris.
Hi, Luke.
So testing remains an essential part of our response to COVID. Tell us a little bit about what happens here and why facilities like this are still so important to our efforts.
So although the impact of the pandemic is a little bit diminished now, thank goodness, there's still a role for testing, particularly for people with symptoms. You should get tested to protect yourself and protect others who might be vulnerable to severe effects of the illness. So we do that here in addition to another dozen or so sites all across the Atlantic Health footprint. But the other important thing that happens here, and the emphasis is on vaccination. Vaccination remains the primary tool to controlling the effects of the coronavirus.
So a lot of folks right now have already gotten their primary series. They may have even gotten a booster as well, and we certainly encourage folks to do that. Right. Yeah. But what about a fourth dose? What happens next?
So the FDA is currently evaluating the possibility and the science behind the fourth dose for both the Pfizer and the Moderna vaccines. The message to you is you should keep your eye on the news. When a fourth vaccine becomes approved, if it becomes approved, you should get it, because that's been shown to diminish the severe effects of COVID, and it's your primary protective weapon against the virus.
We are wearing masks inside right now. This is a medical facility, and as at all Atlantic Health System facilities where folks receive treatment, you have to be masked up to come inside. But there are a lot of discussions right now for folks who are, the weather's warming up, they're back outside, maybe they're gathering again. What's your recommendation for folks as it relates to how to handle masking?
So the one absolute here is that outside is better than inside. That's always been the case. But when you're inside, you should take an assessment of your own personal health risks and whether or not you have chronic illnesses, and your environment, who you're with, how crowded it is, and if appropriate, you should don a mask for that period of time where you find yourself in a crowded indoor space where you don't know the vaccination status of those around you. That's to protect yourself. But again, it's a fluid situation. People shouldn't regard the idea of masks as a red light, green light, yes or no. It's when do you wear a mask and when is it helpful?
Use your best judgment. Good advice. Dr. Sherris, thank you so much for joining us.
All right, Luke, thanks.
All right, folks, we'll see you next time.